Hello, I'm here with Kaylie today. She is one of our practice members and good friends. We're going to be hooking her up. She's been a chiropractic practice member for a while with us, and just want to hear her story and then show you the flow of how we address the things that she's dealing with and help her get where she's trying to get.
Yeah, I've been seeing Dr. Lance for almost 9 years. I came in with a pretty bad herniated disc situation and have since grown so much in my knowledge and just like appreciation for what chiropractic does in my body and outside of that too, emotionally. So I've also got some pretty crappy ankles. So we're constantly working on those. And so this is like a tune-up for a triathlon I'm doing on Saturday.
Yeah, cool. Okay, so let's go face down. Cool. Is there anything specific that you're feeling in the body as the tri approaches?
Upper back was feeling a little tight today when I was working out.
Yeah. You said lower upper?
Yeah, lower upper, and then my feet are just sore from soccer yesterday.
Cool. Yep. You're like a quadrathlete. Cool. So I just start down low. I start pulling on Achilles tendon because it tells me about everything that's going on in the posterior chain. If I target tib posterior here as I dorsiflex and evert, then I can look into the front of the body also and kind of see if I notice that, and there is some hip flexor involvement there. As it wraps around the psoas into the diaphragm, left side's even tighter than the right, so I'll be considering that. Checking how the fascia moves around the calf. She's a triathlete, so it's biking, swimming, running. She's got to use every part of the body this weekend. And we want her to be able to enjoy the process, you know. It's nice to finish a race, but it's also nice to be able to appreciate doing it while you're doing it, not just grinning and bearing it. Big breath in. We're going to create some space in the low back. It's pretty limited travel there, so I'm going to use a couple blocks to just help prop her into posterior tilt. Another breath, lengthen that low back, tuck your tail just slightly, and relax. Good. Another breath as you breathe in. As you breathe in, create space there. Good. Good. And then a couple more. 5 seconds in, 5 seconds out, creating space. Nice little shimmy. Going to help her get some length in the neck also. So a lot when someone comes in, we want to help them release any tension that they already know how to release through breath, through just down regulating the system, so that we're working on the tension and the stress of the body that they're having a harder time releasing. That's kind of what our job is, to accelerate the release of the stress of life so that people can go make decisions and go move their bodies and participate in activities that are fun without feeling distracted by the pain or tension that they're carrying. So there's limited slide and glide of the tissues in this thoracolumbar fascia. I think this is a part that gets locked up for her. If I was to remove these wedges, she would extend right back into that T12L1. So we're going to release the tension here, bring some of it from the rib cage. Have you bend your knees, please? That's a lot better. So now the skin slides and glides better, but also just the joint play, how the body accepts that force there. It's much easier to get into extension. That will help when she's on the bike, trying to be able to extend, when she's even swimming, trying to get the arm to open up, or if she's just trying to live her life. Cool. So now I'm going to address that. She's got that hip flexor that's tight on the side, but that often will become tight as a response to a rotated system. And she's got the left side is closer to the table than the right. She's got this twist happening. I don't know if you guys can see that, but this is higher than this side. It's up this direction. So we're going to be trying to rotate her back through. And the joint that's pivoting around is the L4, L5 on this right side. So we'll bring that into right rotation and release the tension she's carrying in the low back. Face me this way, please. And a rotation like this can show up with like asymmetrical hip flexor tension, sometimes unilateral Achilles tendonitis, plantar fasciitis on one side, not both, general discomfort or tightness in the low back. Good. So we're right there. We're going to be bringing right rotation through that area. I'm also going to be opening up, because she's hyperlordotic, I want to be opening that joint up like that. Another breath. Good. And then flip. Cool. So now we're seeing what changes have been made after releasing that L3, after that releasing that TL junction. She's still really locked down up here. That can be computer work, phone time, watching TV, movies, or triathlon training without breathing up under the collarbone. All of that can be contributing.
Yes.
Yeah. Yes, and. So her body relaxes a lot when I help take that in that direction. So I'm actually going to give a little impulse this direction.
Yeah, I'm already breathing better.
Yeah. So it is going to be going down, around, and through that way. There's multiple layers of fascia in the back, and one of the most important things is to have the skin being able to slide and glide over the superficial fascia, the deep layers of fascia and the superficial being able to slide and glide on each other, because the most superficial tissues here are like the traps that come out and attach to the scapula and help pull the arms, the thoracolumbar fascia, which becomes attachments for the glutes that come down and pull the legs. So the most superficial tissues affect the arms and legs. Underneath that, you have deeper fascia that actually attaches to rib cage and spine and can move the core around. Then the deepest layer are the stabilizing muscles, and you need them to be controlling segment by segment movement. And it's almost like a rotator cuff for the shoulder provides stability for the ball and socket, then the big muscles move it. You have like a little rotator cuff of each segment of your spine, then the muscles that move the spine, that positions and couples motion for the arms and legs to be able to move. So we're trying to negotiate all three layers of those concentric layers of fascia, connective tissue, and stability. And she is unwinding nicely. So much better slide and glide all over there now. We released this right side, so now I'm going to go check the opposite side for that. Sacrum joints. That feels all good. Tuck your tail a little bit, breathe into your belly, squeeze this glute. Is that any low back issue, or is that pretty good stretch in the front?
Nice stretch in the quad.
Awesome. And relax. Okay, face up, please. Which event is your strongest other than swimming?
Bike.
Bike?
Yeah, easily. Actually, bike might be stronger than swimming right now.
Really?
Mm-hmm.
When you're in the run, what part of the body speaks to you the most?
Run?
Uh-huh.
Mental.
Mental. It's just, you're at the end, yep.
It's been pretty pain-free lately, which is awesome and new. I don't know if it's stamina, I don't know if it's endurance, or just the mental. I mean, it's a lot of things combined. But,
when I'm looking at Kaylie's lower quarter, or the leg itself, all the way down to the foot, she mentioned she has these crappy ankles, and she doesn't. She has these brilliant mechanisms that absorb force and distribute tension. But they have a tendency of getting pulled outward. You can see from here that this arch looks really high, that the toe's pointing over my shoulder, and even that the top of the foot is like over there, right? So if I was to help negotiate this to a more neutral position, that would be kind of where anatomical position would be, right? If I let it go, it kind of flops out, but it's from the knee. If you notice, then when I let go, it's not just the foot turns, it's the knee turns, the hip opens. So homework for her would be more about stability and adductor strength and getting control of the hip, and then loading the foot and then the rest of the knee and learning how to use that. But we still do, she got a race in 2 days, we're going to try to help release anything that has her stuck out that direction. One of those places is going to be the bottom where she's hitting. I want her midfoot to be able to pronate instead of have to stay out in that inverted place. So I'm going to be putting her into that neutral, grabbing midfoot, navicular, bringing it down and in, and then helping it be able to drop like this in that direction. I'm also going to be aligning it with hip flexor and timing it with the breath, so the diaphragm, the iliopsoas are all connecting as she's exhaling. I'll drop it down and in and pull. Now, that was a really nice release, like a fascial input, a quick stretch, which can stimulate muscle spindles and things, but I also want to feel more movement specifically from the midfoot. That was a really nice spiral chain, deep front line input. or like a neurological proprioceptive input to the brain, but I want movement from that joint. So I'm going to put her in a little more specific place. So this will have less of a global effect, more of a localized effect, but I'm going to be rotating that foot almost like I'm wringing a towel out, because when we hit the ground running, we want the foot to spiral, and she's not getting as much spiral as I'd like from right there. So it's actually more the joint at the base of the first metatarsal there. So I want the foot to be able to open and rotate down right from there. And this is where we'll get that input. That's a lot better. So now when I'm moving her foot, it's not so directly pulling her entire leg with it. It still has coupled motion, but it's not like, as I try to roll this at all, her entire hip is moving. I can actually spiral the foot isolated. So now I'm going to work my way up to her calf and look at the fascia here, because the fascia is also slightly rotated out this direction. There's like an opening happening at the knee, external rotation of the tibia. So we're going to align that, internally rotate the tib. I'm going to grab some of the fascia of the medial gastroc, the calf muscle, some of the pes anserine tendon, the gracilis, and even some of the medial hamstring, pull that across this way, and then I hold that in place, and now you just lift your toes up and down 10 times. 10, 9, 8, 7, 6, 5. I'm just twisting all the fascia of the lower leg as it relates to the femur, the knee so joint. Nice. Yeah, this is like releasing you into alignment, or at least giving your body the choice and freedom to move into that space if it wants it. Good, and then relax. Cool. So much less exaggeration into that direction. It's still coming from the hip. I mean, she's got more rotation from the foot. That's nice. I know that that fascia at the calf has the ability to now internally rotate here. But when I release it, I can still see that it's coming from that hip joint. So I'm just going to check to make sure that the hip isn't stuck in external rotation. Is that a stretch or pinch?
Pinch at the end.
Yeah, so when that pinches, I use a little tool called a belt. I'll bring you up here. Bend that. Hike that rope all the way up into your groin as high as you can comfortably. There you go. Good. So now all I want, let this leg go, is a little bit of distraction, and then I'll try to get a stretch. Is that still pinchy or is that stretchy?
No. Less, just at the tiny at the end, but yeah. Very minimal.
So I'm going to internally rotate more first, then go. A little stretch?
Yeah.
Cool. Breathe into the belly, really separating the hip from the core. Good. And then if I back off of the tension, do we still get that stretch, or is that pinch back?
No pain. Not a little bit.
A little pinch?
Half a second.
Cool. Let's just clear it through.
That's a good stretch. Yeah.
Good. How you doing there?
Okay.
Cool. Any pinch?
Yeah. The bottom half of the tongue.
So I'm even going to get this calf fascia to turn out with you. So now we're going to move the whole leg in that pattern.
All good there.
Cool.
No pinch.
And if I don't traction, nothing there?
A little at the end again.
Cool. So this time I want you to use your breath. And imagine that there's a little air sac in between the ball and the socket. And when you inhale, watch this, it's like you go, somehow you're like inflating the ball out of the socket. And I'm not even going to use this traction because you're going to create it yourself, just with space and position. Inflate, inhale. Yeah?
Yeah.
So that's how you want to be breathing a bit. Okay?
Crazy how different that is.
Yeah. Yeah. So you're involving your pelvic floor and positioning your pelvis to where you're balancing a little bit of pull from every direction, and it has an effect of like just, it's minuscule, micrometers of movement, but it does make a difference because now the ball can slide on the socket instead of be so compressed onto it that there's no coupled motion. Okay, cool. So I like that. We're going to work our way back up. So immediately when I feel this, there is left-sided tension. And this right side feels just juicy and relaxed. That makes me want to check her right leg.
Left leg?
Left leg. This is the right one. That was the wrong one because we did that. And just kidding.
I'll take it off.
Yeah, so there's no gapping in the subtalar joint. Usually I will grab the talus, this bone in the middle of the foot, and pull, and there's a little gapping. And just so you can feel what I'm talking about, Kaylie, it's like that.
Yeah.
That little
wow,
jiggle,
yeah.
right?
Mm-hmm.
This one doesn't have the jiggle. So I'm going to give a little gapping, a little distraction. And again, I'm thinking about coupled motion. So she's not getting any rear foot inversion or eversion. It's not dropping out. It's something we want. When you pronate, yeah, that heel should be able to drop out a little further than that. It's getting caught in here. I think partially because the mortise is just jammed and compressed. So we're going to be pulling down and out that direction for coupled motion of the calcaneus. Then we'll recheck the talus. Talus doesn't have any muscles that attach to it, so I like to work with structures that have muscular attachments. It gives more mechanotransduction, more proprioceptive input to the brain. I'm also checking just which chains up the leg would be easiest to target with this. And it is going to be a little dorsiflexion as I go through it first. So it's going to tug up and across, deep front line. So that tib posterior will be the target that I have up the leg, which means I'm working with the front of the body. So I'm thinking more about how do I pull in a way that engages the hip, and now I can feel all of that together. So now when I do it, it'll be a impulse that direction while I pull down. And I want to feel the calcaneus move. As she's exhaling, that rises her diaphragm. Good. So now I recheck talus. Still nothing. So now we're going to go medially to feel the talus move on the malleolus. I'll go laterally, feel talus move. And it's definitely more a medial set down into dorsiflexion while I distract. I do want to get that gapping, but I don't want it to gap from the hip or from the knee. I want it to be from the ankle. So I'm going to have her create a little stability first. So as you're breathing, I want you to feel like you hike your hip towards you a little bit, so you're really controlling. Yep, and then relax the ankle as much as you can. Good, that was great. So now we have that jiggle. Feel that? Cool. So now I work down the chain. Now calcaneus is wiggling a lot better. Now I have my talar jiggle, little subtalar joint movement. And now I'm feeling, does the foot roll in with ease? And that feels like it's stiff. It was like this was before I adjusted into that rear foot or midfoot. So now I'm coming across, noticing where is it stuck. On the other side, it was more navicular. This feels like it's first cuneiform. A bunch of little bones in the middle of the foot, and each one of them has a purpose. I want that cuneiform to be able to roll down and in while this stays stable. The mid and rear foot should be able to pronate down. And right now she can now pronate from the rear foot, but this is getting stuck laterally. You can see this big kind of like nodule that's sticking up. It's just a tendency of staying laterally like that, and that's going to not allow her to finish her stride. So I'm going to come through. Squeeze your glute just a little bit. That holds everything in external rotation while I start to try to bring her down and across and in. Good. Now slowly start to relax your glute just a little bit. And relax. So again, looking at rear foot. Midfoot now moves awesome. As I go through this direction, her whole leg participates. She still has some instability, so homework for her is going to be foot control, like learning how to stabilize the forefoot while the midfoot learns how to pronate. We have some tools that we send home with folks to do that. And then getting the glute to connect into this big toe and have that whole mechanism. Right now it's obviously just shortening as a compensation. So getting really comfortable with the body being in a shock absorbing position, especially if you're going to be putting tens or hundreds or millions of thousands of steps. I'm going to do a similar release at her knee joint because we're just seeing that the tibia is externally rotating on the femur, which if you think about like the grooves of the knee, if the tibia rotates on the femur and those grooves don't line up, that's going to become really irritating. And the body, rather than just grind, it's going to start to make certain things tight and it's going to share the load with the rest of the body. You'll notice low back pain because that's an area of instability, or she's already rolling onto the outside of the foot a lot to try to offload probably some of the compression of the knee. So because we've now given her more shock absorption at the bottom, we're going to be turning internal rotation of the tibia and getting all the fascia associated with that, holding it there, and then you lift up and down with the toes and ankle 10 times. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1, and relax. Cool. Nice. How you doing?
Great.
Cool. Cool. A little bit more loose already. And that could be because I released the leg, could be because she was breathing, because she hiked her hip, and some type of change. You can have a local change in the body that has a global effect. And already from a homework standpoint, we're going to be having her do some foot stability work, have her do pronation training on one of our little tools, foam roll the calf in a way that turns that lower leg internally. So now I'm identifying where is she limited in extension, rotation, lateral flexion, where is she carrying more stress. A lot of people ask me what we're feeling for, and on a big scale, one of the things you can do yourself is just take your left hand and feel your right forearm, and you'll notice what kind of a nice healthy muscle feels like, unless you have some type of forearm issue. But most forearms feel just soft and supple. And now if you just squeeze your middle finger, just your middle finger really hard, and everything else stays relaxed, you'll notice part of your forearm now is really tight and part of your forearm is still relaxed. And that tight muscle, because you are contracting a single muscle, you'll notice a band of tightness. And what we do as chiropractors is identify where in the body are those bands of tightness. Even though someone's not actively trying to contract one thing, subconsciously they might just be holding tension in a certain way. And it can be something that they chose to do a long time ago to deal with stress. It could be something they're doing every single day in their job, or they're carrying kids, or they're at their desk, or they're on their phone. And these muscles that they use over and over and over start to shape their body in certain patterns. And we can accelerate the deformation back toward neutral. It's kind of like doing bonsai work, like we're pulling the tree back toward a more balanced, open position so that people can be moving in all these directions, stressing themselves without overloading one tissue. And so I'm noticing that she has a little bit more tension at her C5 than she does in other areas. And the C5 is something we'd want to be really springy and light. And then there's a bit more on the upper cervical left than there is on the right upper cervical. So we're going to address her upper thoracic first, because we already addressed that when she was face down. I'm going to release that because that's going to help bring more ease to the neck. Lift your head, please. And then relax back. I'm going to scoop down that direction.
She was ready.
Mm-hmm. Okay, so next is that C5 we talked about. Oftentimes with C5, we can adjust it, but I like to also help the body make deeper and deeper adaptations. So we'll often use a tool like a block like this. Lift your head. And I'll put it right on that C5 and have her come back. Is that comfortable there?
Yeah, it's good.
Cool. So this is just a traction device that allows the C5 bone to be pushed forward, which creates that, like, she's got somewhat of a flattened cervical curve, and we want that curve to become more circular. That gives like a spring and a shock absorbing mechanism in the neck, connects a lot of the chains from the neck down through the rib cage to the diaphragm to the legs. And then as the weight of her head is falling back and the front of her neck is opening, that'll decrease a lot of tension in the chest and the shoulders. And then I'll often use these blocks again to go back, influencing the fascia of the lower leg. So I'll turn that back into internal rotation, and I want that leg to be more aligned. We'll come here, get the fascia of the calf to turn in, and then I'm just looking to see, does that seem relatively aligned on that plane? And now when she's breathing into the diaphragm, the crisscrossing abdominal muscles that these adductors and abs connect through, this whole system is now connecting top and bottom. And as she lets the head fall from there, the legs are providing a downward tractioning force at the sacrum, and the breath is now tractioning up on the lumbars, so she gets much more opening by the weight of the head going that way, the weight of the legs going that way. And we'll usually give her just 90 seconds, 3 minutes, or send this home as an exercise to be doing up to 15 minutes a day. And Dave, a couple days before the race, this is just nice to help. 5 seconds of breathing in, 5 seconds of breathing out. You know, the ideal breath for the average person is 5.5 seconds in and 5.5 seconds out. And it starts down low into the pelvic floor, like nothing moves for 1 second of inhale. Then after 1 second, the pelvis has expanded slightly. Then it's the abdominal cavity. Then after a couple seconds, it becomes the abdominal cavity and a verticality into the ribs. And then in the 5th second, the head, chin tucks, the head like a balloon starts to float upward. And now we have a full capacity of breath. When I go to exhale though, I don't want to breathe out for 5 full seconds because I would be completely collapsing back down everything that I just built. So my exhale might only be, after an inhale of 5, my exhale might only be 3, and it's going to be from the bottom up. I maintain all my space here. And now I inhale 3. And I exhale 3. I like to think about it like filling my bottom half of my container, then my upper half container, then exhaling my bottom half, and only breathing now with my in and out coming from my bottom container. So I maintain a container of air, or half a tank of gas all the time. I'm a huge fan of foundation training. They talk about decompression breathing. Feldenkrais talks about pulling the back toward the sky this direction. You know, anyone that's talking about lengthening the spine and maintaining that length as you're living, I'm a huge fan of. And the breath is the inflation and creates that expansive stability. So after a couple minutes here, we can start to unwind, and then we'll already know what she was able to release. And if it's significant and meaningful and impactful, we can just send that home as homework and know that she has another tool in her belt. So it's definitely helpful. She has a little bit more spring, but I still feel a restrictive barrier at the end of that joint range. So that's where I'm going to help take C5 into more extension and see which direction it would want to go.
I felt the expansion though, and more space for sure.
Yeah. Yeah, so we're going to be coming from the left over. Up into extension. We're going to drop the head just like that traction was happening.
Oh. Yep. He was locked up. Good morning.
Buenos dias. Yeah, it's pretty nice, especially after the traction, because it loosens the pickle jar a little bit. So now I'm checking the other side to see if there's any more that we could get from there. And I do think there is. So we'll do C5 other side too, and just take both of those into extension. Similarly, we're going to go to that same side. We're going to bring it up into extension with the whole head. Drop the head and turn.
That was deep.
That was deep. Yeah, when you get both sides, I mean, it literally like the entire spine now.
I felt it all the way here.
Yeah, the spring mechanism is back.
Yep.
Now you can absorb every step with every part of your body instead of everything just jamming into the low back. Good. Move your hands slightly. So this is just like a fascial slide and glide. So I'm going to help, especially as you exhale, just help drive up. Good, just natural breathing. So when we do fascial work in the belly, in the abdomen, we're working with the muscles, the abdomen, like the obliques, the rectus, but also the visceral fascia, like the connective tissue that the organs float in, can also get tied up. Organs themselves, every time I bend, all my organs have to fold and maneuver around each other. And if the connective tissue there gets stiff and tight because we have very few positions that we get in, then it's nice to get some spirals and just long hold, superficial work, but profound impacts. That can help with breathing, that can help with digestion, and even just slow controlled pressure through here with this breathing decreases heart rate, decreases blood pressure, down-regulates our fight or flight response, sympathetic nervous system, up-regulates our adaptability, growth, healing, repair, recovery. Or in advance of our training, our triathlons, it's like pre-covery, prehabilitation, you know. Cool. Locked and loaded. I have one more thing for you. This is like a self-induced traction. So I want your hands to be this direction. You're going to grab onto this bar, squeeze your knees together, toes toward your face. Right there's perfect, just like that. So your lower body's providing a downward tractioning force. And now I'm going to lightly pull here, tuck your chin. As you inhale, I'm going to lightly pull. I want you to just connect the shoulders to the abs as you exhale. Hold on tight. We're just tractioning. One more big breath in. Tuck your chin. Exhale from the belly. There it is. That's all the triathlon muscles. Nice work. And relax. That's nice, right?
Yes.
Yeah, so if you have a bar,
Okay.
knees together, because that's the internal rotation we need. Then this is the external rotation that provides traction that direction, because that's the opposite of this.
Right.
And then you create external rotation and flexion, internal rotation and extension, but it's all about stability of the core. And then it's like, oh, you know. Yeah, and that's the dynamic stability of the core when you're swimming, when you're riding and your legs trying to go, when you're running and you're trying to go, but everything wants to open and be flexed, like just wrapping it in, stabilizing it, and then getting really good at reaching away from your center, but without losing the connection to it. That's the secret.
Thank you so much.
My pleasure.
A whole layer of stress and comfort.
Cool. So that's the flow. How does it feel now compared to how it was, and how does this compare to other times that you come in? Is this like a typical flow, or is this different, or yeah?
Yeah, Lance always covers head to toe, especially with my feet being the way that they are, and I'm already like, I'm like Zen mode, you know, post massage, you're like, I want to go take a nap, but in the best way. I'm excited to go see how my body moves later today too. But yeah, like he was saying about that sympathetic nervous system, I'm just like at ease now. Like it's really nice.
Awesome. Yeah, we talk about something called the ideal tension state, and the cells of our body actually function well and ideally when compression and tension are balanced in as many cells as possible. And as we live, even just sitting here like this, one leg is dropped, so I have a little bit of extension in this side. If I just disengage, I'm not balancing tension and compression equally. My body's not going to function well if I do this all the time. Some people like to cross one leg over the other. Some people like to carry something on one shoulder. They like to wear shoes that crunch their feet. And so many different ways, 1,000 different ways in the body that we can just be constantly thinking, how do I balance those two forces? And if I can start to shape my body and have that be my new normal, we can perceive so many subtle ripples of life and squeeze more juice out of it if we are distracted by the stress we're carrying in our body, and then life keeps just loading more on top of us. It becomes overwhelming, and that's how we find most people stuck in that state. And we'd rather have them come in and be stoked and released and remove the stress, literally move the stress again. And we won't take it away from you, but we will get it moving so that you can go move in your life and cope with the stresses that both build your dream life. Like, the stresses that are in our lives are what produce all the best parts of our life. But if we don't acknowledge them and have recovery strategies and recuperative strategies that match that load, then it's a net negative, and over time things just get harder and harder, rather than us getting stronger and stronger and unlocking the parts of life that we've been hoping. So that's what we want for you. We welcome you anytime you want to come. Golden Gate Chiropractic, we're in the marina, we're in the Sunset, we're in San Jose. We'd love to see you or your loved ones. And if you've never had chiropractic care, we'd love for you to experience it for the first time with us. And if you've had it in the past, we'd love to welcome you back if it's been too long. See you guys soon.